my name is Serena. I'm one of the technicians here at Saddleback Eye Center, and I will be going over all of your aftercare instructions with you today. So first and foremost, congratulations on finishing your LASIK procedure. There are a lot of steps to ensure you get your best vision possible after the surgery, so let's dive right into it. So first thing is you're going to receive 2 different bags today. You're going to get this little black bag, and you'll be receiving this big green bag as well. Both of these bags you need to bring back with you to your post-op appointment, and you want to make sure you have everything inside of them with you as well, especially your eye drops. You want to make sure you bring those back, and you typically want to arrive about 10 minutes before your scheduled appointment time. That way we can get you all checked in and settled in before we're able to bring you back into one of our exam rooms. So, a few things I want to address before we get started on what's inside of these bags. First thing is that if you look in a mirror right now, you're going to notice that the white parts of your eyes will be very red. That is normal. Every single surgery patient comes out with the red eyes, and the redness is mainly from all that pushing and that pressure you were feeling during your procedure. It will not affect your vision at all. The redness will actually go away on its own in about 3 to 4 weeks. Second thing I want to address is that your vision might be a little bit foggy, a little bit hazy right now. Again, that is normal. Every single surgery patient experiences that. And that fog and that haze will slowly go away on its own over the course of the next few days. Expect it to be foggy for at least the rest of today. Tomorrow morning when you wake up, the vision will be much better. So, let's talk about what's inside of these black bags. First thing you're going to notice is that there's going to be a little pill right here. This is a Motrin. If you feel any discomfort after your procedure, that is normal, but if the discomfort becomes a little bit too much for you, you can take this Motrin, or there will also be some acetaminophen inside of the black bag as well that you can take later on when you get back home. Now, one of the first things that you'll see inside of your black bag is a few sheets of paper folded up just like this. The white sheets of paper here will go into a little bit more detail about how to take care of your eyes. The green sheet of paper are going to be the key points in how to take care of your eyes after your LASIK, and this video is actually going to go over every single point on this green piece of paper, so you can rewatch the video or you can read the instructions later on when you get back home. We're going to start off by talking about how to protect your eyes after your procedure. So it's very, very, very important that you don't touch, you're not rubbing, and you're not squeezing your eyes together for at least the first 3 days after your procedure. Now, we have what we call a 1-inch no-touch zone, meaning within 1 inch of your eye is going to be this soft tissue, and you are not to touch around this area for the first 3 days. Anything outside of the 1-inch zone is going to be outside of the bones of your eyes. So this bone and out, this bone and down. You can touch outside of those areas, but anything within that area, any of that soft tissue, you are not to touch it, or else you can wrinkle that flap that we made on the first laser during your surgery. Now, you will be wearing eye protection for the first 5 days and 5 nights, and you need to have this protection on 24 hours a day. So that means you have to wear the protection even while you're sleeping. You are going to go home with this pair of goggles that we gave you right after your procedure. To put these goggles on, you want to pull the legs as far apart away from each other as possible, and then put them on your face. Now, since you will be sleeping with these on, you're going to have some tape inside of the black bag as well. There are 4 strips of tape on this piece of plastic, and each strip is very, very sticky, so you want to avoid getting it into your hair. You can tear off some of the excess on the bottom if you need to, but each strip, you're going to take one, put it on your temple, put it over the leg of the goggles, and tape it to your jawline. So it's going to go temple down to jawline, 1 piece of tape over each side of the goggles to help secure it to your head at nighttime. There is also a piece of paper inside of your black bag that gives you a visual demonstration of exactly where to place the tape as a reminder. Now, when you're taking the goggles off, you never want to pull them straight off your face. You always want to push them to the top of your head first, and then up off the top of your head. These legs do point inward, so if you pull them straight off, they can snap back and poke you in the eye, and we don't want that whether you've had LASIK or not. So always be very, very careful when you're putting on and taking off the goggles. You will also be going home with a pair of little glasses like these. There's no prescription in either lens. Both lenses are completely clear. These glasses are for during the daytime. If you're walking around, maybe at work or school, and you don't want to be wearing your goggles, you can wear these while you're indoors. If you are outdoors, you want to make sure you have a good pair of polarized sunglasses on. That will help delay cataracts later on in the future by protecting your eyes from the UV rays. As for the eye drops that you'll be using, you'll have a total of 3 different eye drops. You have 2 medicated eye drops, and you have your lubrication as well. Now, for your medicated eye drops, your first one will be your antibiotic. It's called moxifloxacin. You're going to use this 4 times a day for the next 5 days. And you still need to get this drop in 4 times today before you go to bed. Your next medicated eye drop will be an anti-inflammatory eye drop called prednisolone. And this eye drop will be 4 times a day for the next 10 days. And again, you still need to get this eye drop in 4 times today before you go to bed. Now, with this prednisolone, this anti-inflammatory, all of the medication is sitting at the very bottom of the bottle. So you want to make sure you give it a good shake so that you evenly distribute the medication throughout the bottle before you put the eye drop in. Now, for your lubrication eye drops, you're going to be using these ones every hour today. And starting tomorrow, as soon as you wake up, you'll be using them every 30 minutes for the next 30 days. And these are very, very, very important, just as important as your medicated eye drops, because dry eyes will delay your healing. So for these little ones here, you want to tear off one. You're going to twist this little top part and pull it off. That way you can open it up, put the eye drops in, and then you're actually able to snap this little cap back onto the top. That way you can seal up the vial and use it until you completely run out before you open up a brand new vial. Now, for all of your eye drops, anytime you put in any kind of eye drop, you always want to keep your head parallel towards the ceiling, and you want to put the drop in the inner corner of your eye. Keep the tip of the bottle or the tip of the vial at least 1 inch away from your eye. That way you don't accidentally poke your eye. After you put the drops in, you want to keep your eyes closed for about 30 seconds. That way when you open it up, it gives your eye time to absorb that eye drop. One more thing to note about your eye drops is that you never want to put them in back to back, one right after another. If you do end up needing to take 2 different types of eye drops at the same time, you want to wait at least 10 minutes in between each type of eye drop. It doesn't matter which one you start with first, as long as you take one, wait 10 minutes, and then do your next one. That way your second eye drop does not flush out your first eye drop that you put in. So please make sure you wait at least 10 minutes in between each type of eye drop. So that will be everything that's inside of your black bag. There are a few things I want to note in terms of aftercare. First is that there is no sleeping with the ceiling fan on for the first 3 months after your surgery. That circulating air will dry out your eyes while you're sleeping. No alcohol for the first 72 hours after your surgery. Alcohol dries out your body in general. That will also dry out your eyes. And then in terms of showering, you can shower, but until we see you for your post-op appointment, you do not want to wash anything from the neck up. So no washing your face and no washing your hair until you come back and see us for your post-op. So now let's go over what's inside of this big green bag here. Inside, you're going to find a box of your lubricating eye drops. This box is exactly what it looks like in stores, so you'll know exactly what to pick up when you go buy some more of these eye drops. But you want to make sure that they are the PF, which stands for preservative-free formula, and make sure that they are in little vials. The second thing inside of the green bag is going to be this folder. Inside of this folder, there's going to be a chart, the first thing that you see. This chart is so that you can check off all of your eye drops as you do them. That way it'll be a little bit easier to keep track of them. The top portion here is going to be your 4 antibiotic and your 4 anti-inflammatory that you're doing today before you go to bed. And then at the bottom of the chart starts your eye drops tomorrow. There's going to be a few more pieces of paper in here that go over how to take care of your eyes a little bit more in detail, how to use eye drops, some information on how to clean around your eyes, and such and such. There's also going to be a little sticker here that teaches you how to get to this exact video on our patient portal so that you can rewatch the video as needed. If you have any questions about your aftercare or the condition of your eye, feel free to give our office a call and we'd be more than happy to help you and answer any of your questions. Thank you.